you so much for tuning into the Wellness Nurse podcast. If you are serious about improving your health, then you are absolutely in the right place. I'm Ros Lindsay, your compassionate and fierce advocate for a healthier you. I'm excited to talk to you about something that could potentially change your life: preventive healthcare. Imagine being able to avoid chronic diseases, save on medical bills, and live a longer, healthier life. Today, we'll explore how preventive healthcare can make this a reality for you. So before we dive in, just note that the Wellness Nurse podcast is for general information only. It's not intended as medical advice. Always consult your medical practitioner when you incorporate changes to your healthcare regime or seek individual medical advice. Let's start by looking at the current health landscape in Australia. Chronic diseases like heart disease, diabetes, and obesity, stroke, and dementias are all on the rise. These diseases are often linked to lifestyle factors such as poor diet, lack of exercise, and smoking. But here's the good news. Many of these conditions are preventable. By making small changes to our lifestyle, we can significantly reduce our risk of developing these diseases. And this is where preventive health comes in. There is a national preventive health strategy for Australia, and certainly there is a lot of rhetoric saying that preventive health is vital. Indeed, there have been some very successful campaigns for cancer screening and tobacco control that have saved many, many lives and saved billions of dollars in healthcare costs to Australia. However, there are some significant challenges in our healthcare system, and we continue to maintain a health system that works within an illness model of health. That is, it's a healthcare system that predominantly provides healthcare when you get sick and not so much beforehand, even if you are at risk. For instance, often there is limited time for your GP to spend with you, and they may only have time to provide generic health advice around losing weight, eating well, and exercising more. I attended a 3-day conference last week in Adelaide on primary healthcare and lifestyle medicine, and it became very clear that there is a rising number of GPs in our country that are at risk of burnout because the demands being placed on them by this rise in chronic disease is so great. The reality is that it is unlikely that you will receive a tailored plan to prevent disease, even if you are at risk. And this is because a health management plan or a chronic disease management plan is only covered by Medicare once you have been diagnosed with a chronic disease for 6 months. I don't think it's acceptable that we wait for you to develop a chronic disease before we give you an individual healthcare plan. There are clear known risks for chronic diseases such as type 2 diabetes, cardiovascular disease, sleep apnea, stroke, dementias, and some cancers that are associated with lifestyle. We know that the risk of these chronic diseases can be reduced by even small changes to your lifestyle, but we also know that a broad brush, generic approach to making those lifestyle changes rarely works. While it's certainly possible to make some changes on your own, having professional guidance and a specific plan can make a big difference. Very soon, I will be launching an online nursing service to help fill this gap. We will offer personalised preventive health plans tailored to your specific lifestyle. A plan for someone that lives in remote rural Australia looks quite different to an executive public servant in a capital city. Our services include one-on-one consultations, customised wellness plans, and continuous support to help you stay on track. My vision is that Australians will become the healthiest, longest living people in the world. And our online platform will ensure it is convenient and easy to access these services from anywhere in Australia. Today, I thought we'd look at another factor that is worth considering when we're contemplating making changes to our lifestyle. In last week's podcast, I discussed the gap between knowing what we should do in terms of being healthy and actually doing it. So please listen to that podcast if you haven't already to get some useful tips in bridging that gap. It's really crucial that we find a reason for ourselves as to why it's important, essential to achieve better health. A friend mentioned to me the other day that it's hard for him to find his why, and this reason why he must achieve better health. And this is actually really common. And that's why it often takes a health scare to give us sufficient motivation to do what needs to be done. For me, my why, my reason why I decided to invest in my health was that I didn't want to have a stroke or a cardiac event. Being overweight at the time, my sleep apnea was recurring, and I knew I had to make a change. Not everyone has these early symptoms or has experienced that moment of mortality following a heart attack or a mini stroke. Many people may be at risk but are still functionally very well. So I have compiled some examples of other people's reasons, other people's whys that may resonate with you. They may inspire you to take some time to think about your why. The list that I have may help you narrow it down, but you may have an entirely different reason altogether. So here are 6 categories and some examples of reasons that people give that motivate them to make change and keep them going when they don't feel like it. The first one is family and loved ones. For example, I want to be around to see my children grow up and be able to play with my grandchildren. Or I want to set a positive example for my family and inspire them to live healthier lives. Quality of life is another category. I want to have more energy and vitality to enjoy my favourite activities and hobbies. Or I want to feel confident and comfortable in my own body. How about longevity and prevention? I want to reduce my risk of chronic diseases like diabetes and heart disease to live a longer, healthier life. Sometimes that's enough for people. Or I want to avoid the pain and discomfort associated with preventable health issues. Or I want to travel the world during my retirement. How about that one? Or personal achievement. Some people want to achieve their personal best in fitness and wellness, pushing their limits and reaching new goals. Or they want to feel a sense of accomplishment and pride in taking control of their health. For others, it's mental well-being. I want to improve my mental health and reduce stress and anxiety and depression. I want to feel happier and more balanced in my daily life. For others, it's professional success. I want to be at my best professionally with the energy and focus to excel in my career. Or simply, I want to reduce sick days and increase my productivity at work. So there are some ideas. I hope that you can spend some time thinking about what your why is. Thank you for tuning into today's episode. Remember, your health is one of your most valuable assets. Take the time this weekend to reflect on what better health could mean for you and your future. If you have any questions or want to join our waitlist for the Launch Longevity package, please email me at roslindsay@launchlongevity.com, and I'll put that in the show notes. The first 20 emails will be eligible for a significant discount on this package when we open it up in about a month's time. And please also consider sharing this podcast with your loved ones who may be looking for a free resource to help them achieve better health. My aim is to release an episode of The Wellness Nurse for you each Friday, and I've done that for the last 3 months. Woohoo! And hope that you're finding something of value in each episode. I'd love to hear your feedback in the comments. Until next time, thank you for your time in prioritizing your health and listening to this episode of The Wellness Nurse. Please take care of yourselves and see you soon.